3, 2, and 1. Welcome to Community Health Matters. I'm your host, Amy Marsalis. On today's show, we'll learn about youth joint replacement, autism, and financial health. All of that coming up next on Community Health Matters. From the News Channel 5 network, this is Community Health Matters, sponsored by the United Health Foundation. It's hard to believe that, but more than 7 million Americans are walking around with man-made knees and hips. And Dr. William Kurtz is here from St. Thomas, an orthopedic surgeon, to talk about really this growth in younger people having these man-made parts.
Right. So
why is that? Just right out of the gate, why are we seeing so many young people?
Well, a lot of us have been playing sports all our lives,
Yeah.
and so we've had old ACL injuries and had a couple surgeries along the way. And so ultimately, when a lot of people are getting in their 50s and 60s, their knees are more like the knees used to be when they were 70 or 80. So we're seeing a lot more arthritis at a younger age, mostly due to traumatic injuries in their sporting careers earlier in their life.
So usually an injury triggers it more than just overuse.
Correct. Usually a lot of these younger patients are post-traumatic. They've had sporting injuries at some point in their life, and it just kind of catches up with them maybe 20 or 30 years later.
Mm-hmm. What about the incidence of obesity with that's really hard on your joints, in particular your knees, right?
That is correct. The obesity is definitely takes a bigger toll on your knees than any other body part. And so patients, unfortunately, a lot of our community is a little bit more obese than we used to be, and that has driven the knee arthritis rates up and the knee replacement rates up as well.
Is there anything else contributing to this? Is there any other activity that we are doing or not doing? Are we not stretching enough? Is it a lot of running? What in particular?
Well, actually, I think it's a misnomer, but exercise is actually protective to your knee joints. So gentle, everyday exercise actually helps keep your cartilage healthier. And so I think a lot of us have stopped exercising, at least not as much as we used to. And so that actually, when you stop exercising, that can contribute to developing knee arthritis over the years. So if you're out there, try to keep exercising as much as you can.
What do you think about yoga? Do you like yoga and Pilates?
I love yoga. I don't personally do yoga. I wish I did, but it is a wonderful form of exercise to work on balance and strength in a very low impact way. I always recommend yoga if you have the opportunity.
So by the time someone gets to you, obviously for the surgery, they've been through a number of diagnostic kind of tests. Walk me through what a patient would go through.
Sure. So we offer usually about 5 or 6 different non-operative treatments, and I always encourage patients to utilize that as much as possible. So we never in a big rush to do surgery on patients. We try to postpone that as long as possible. But most patients will try some anti-inflammatories. There's about 3 or 4 different types of shots we can give them into their knee joints. They'll try some exercise programs, maybe some weight loss programs, and some bracing sometimes. And we try to maximize that and do that as long as possible. When all that stuff no longer works and the person's quality of life is really suffering, that's when we start talking about doing a joint replacement.
Could physical therapy also be kind of a stopgap measure?
Sure. A lot of us have muscles that aren't quite as toned as they used to be, and so a lot of times therapy will, a therapist can help stabilize patellas and strengthen the joints so that they can hopefully postpone a knee replacement for a while.
But you do a lot more knees than hips, correct? Or nationally?
Nationally, that's the case. I personally am about 50-50.
About 50-50, okay. So if you have a knee replacement, is that good for life? Let's say let's throw out an age. Let's say you're 50 and you have a knee replacement. Is that good for life? I know it depends on.
It depends. Usually knee replacements are going to last 20 to 30 years.
Okay.
The materials are a lot better than they used to be. So, if you were talking about 20, 30 years ago, then those knees would last maybe 10 or 15 years. But we've gotten the material science down pretty good. Usually you can count on 20 to 30 years as long as you don't fall down. That's probably the number one complication I see is people falling and breaking things. And you can still break bones with a joint replacement. So just got to be careful. You got to be kind of common sense approach to how you treat your joint replacements.
Can a lot of people do what they did prior to and even more? Obviously, if they're in a lot of pain leading up to that, they're probably going to be able to do more than they did before. But can they, can you still go back to running?
Sure. With a hip replacement, you can do anything you want to do. I've had some of my partners swim 3 miles in the ocean, jog marathons. All that stuff is easily doable with a hip replacement. With a knee replacement, most patients are walking instead of jogging, but some do jog, but that's on the rare side. With a knee replacement, most of them you're gonna lose a little bit of your proprioception. You lose your ACL, so you're not doing cutting and pivoting activities with a knee replacement, but you can exercise, you can golf, tennis, hike, snow ski, that sort of stuff.
If it wears out, how do you know? Is it pain, or what happens to indicate that it's not working anymore?
Sure. Well, some patients do catch it early and they have mild symptoms, and we can go in there and do some small surgeries to give them another 20 years on that knee. Just by replacing the plastic. But more often than not, patients don't really come into the doctor when they should, and we end up seeing more wear and tear on the bones, and that sometimes requires a bigger surgery.
Okay. Now, are there benefits to having the surgery at a younger age? Is it better to try to wait and put it off as long as possible, or to get in there earlier?
I generally counsel patients to wait if they can. It's easier to recover if you are younger. That is a plus side, but these implants are 20, 30 years, and if you're 40 or 50, if you can postpone that surgery, I think it's in your best interest. But if you're miserable, if your quality of life is suffering, then just go ahead and get it fixed, because you want to have a productive life. You don't want to be in misery all the time.
My husband and I, we have a friend who just went through a hip replacement, and I think they had said, listen, you'll recover faster from this than your back surgery.
Yeah, for sure.
That's the case now,
yeah,
right?
Hip replacements, 3 or 4 weeks, they're back to doing most normal things. It's pretty amazing.
That is incredible. How fast do you get someone up and moving after you've done a hip?
An hour or two after their surgery.
An hour or two?
Yeah. These implants all surgeons put them in so that they're solid right from the beginning, so you can get up and do normal things. My one and only rule is just tell people not to fall down, and that's the main concern.
What's the material? Did you mention plastic?
Most of the part that bonds to the bone is titanium, for the most part, and then the bearing surfaces are usually polyethylene.
Okay, all right. One last question before we wrap up. Are there any alternative treatments to these replacements?
Sure. There's, like I mentioned, there's about 5 or 6 non-operative treatment things, which are shots, cortisone shots, lubrication shots, platelet shots, or anti-inflammatory medicines. And general exercise. I think keeping your muscles strong is a good way to prevent having these joint replacements.
Okay, and you said, again, just moving around, probably walking, swimming are some of the best.
Swimming is great. Yoga is great. I like closed chain activities, which is like a stationary bike or a rowing machine, because it's non-impact and really can help strengthen the muscles without wearing them out, the joints.
All right, Dr. Kurtz, thank you. Very informative. Appreciate it.
Thank you, Amy. I really appreciate this.
All right, take care. And we'll be back with a lot more right after this. So excited about this next segment. It's about autism spectrum disorder, and my guest, Lauren Weaver, who's been here before. Good to have you back,
yes,
Lauren.
Thanks for having me.
And Amy Swanson, you're both with the Triad at Vanderbilt, which is, let's first of all explain what that is.
Yes, Triad is the Treatment and Research Institute for Autism Spectrum Disorders. It's a program at Vanderbilt Kennedy Center. And we work to improve assessment and treatment for individuals with autism, their families, in community settings and beyond.
And we know there is so much exciting news about your partnerships, if you will, throughout Nashville that's kind of new. Bring us up to speed on that.
Yes, it is such an exciting time to be in Nashville. We are such a great city and community, and Nashville, we have the Inclusion Network of Nashville, and that is a group, a collection of 33 organizations, 23 community organizations like the zoo, the opera, ballet, Cheekwood, the places you go with your families, as well as 10 disability organizations. And we come together twice a year and put together trainings and resources and have events specifically focusing on accessibility and inclusion for individuals with disabilities.
Inclusion is the key.
Inclusion is key, and no one else is doing this quite like Nashville is. We are doing it the biggest and probably the best.
We're leading the way.
We
so
are.
That is great news since you were here the last time.
Yes.
That's new. Love breaking news on the show. Okay, so how does Vanderbilt support and treat those affected by autism? Yes,
we have so many different programs in partnerships at so many different levels. But if there's someone who has a concern for autism, we have the autism evaluations, and that could be point one. And from that, we have family training programs, we have early intervention services, community trainings, events, and research projects that can support and have opportunities for families to participate and help individuals with autism.
This is great to dovetail from that right into Spark, Amy, which so nice to have you here to talk about what is Spark, what is it doing for people affected by autism?
Yeah, thank you. So Spark is the biggest genetic study that's ever been conducted. So we are, and it stands for the Simons Foundation Powering Autism Research for Knowledge. And it's really, its main aim is just to pretty much dramatically advance what we know about autism in order to better serve families and to improve lives of families. And we do that through collecting genetic makeup through saliva from families all over the nation. So Vanderbilt University Medical Center is working with the Simons Foundation in New York and 20 other centers across the nation to be able to do this and to really understand the genetic underpinnings of autism spectrum disorder.
It's such a complex and far-reaching disorder that's been so mysterious for so long. So why should families unaffected by autism sign up for this?
Sure. So we really hope that in the future, really understanding autism is going to lead to better interventions, earlier diagnoses, all types of things. But we want Spark participants to have benefits today. So by joining the network, they have immediate access to experts on all types of topics through webinars and other web-based channels. So they can learn different tips on daily struggles that come up that are very common to families, as well as things that just may be very specific to a certain point in development, like transitioning from high school or toilet training in young children, things that families can look to for tips at different times as their child gets older, as well as for adults.
Okay. Are there certain qualifications to be a part of this study?
So any individual with autism, a professional diagnosis of autism, is welcome to participate, and they'll be invited to invite their family members.
Okay. And is there any cost involved?
No cost at all
cost
to
involved.
families.
Okay, now let me bounce back to Lauren for a second because we didn't really go over the basics as far as autism spectrum disorder. I know from previous medical reporting many years ago that early intervention was so critical, identifying children as young as possible. Is that still the case?
Yes, very much so. So there is no cure for autism yet, but there are effective treatment options, and one with the most research behind it is applied behavior analysis. And what that is really looking, it's a science, looking at how can we change the environment to change behavior. Because when you're not changing the person, you're changing the environment that they have to work in. And so you do that to have long-lasting change, to teach them new skills.
And what the goal is with those skills is hopefully these young men and women can live independently.
Yes.
And be in relationships, which we know many are. But that is the goal, isn't it?
Yeah, independent living, quality of life, it's no different for an individual with autism than it would be for you and me.
What have you learned from this study so far?
So we have a long way to go, lots more to collect, lots more analyses and sequencing to do, but we are seeing some of the genetic markers known to be associated with autism are coming up in about 10% of the families who are enrolled. And some of these genetic markers are de novo, which just means that they're brand new to the individual with autism. That means that they haven't been inherited from the biological mother or father, which is very interesting. That's really going to be something that the scientific community will look very closely at to see what that means for families and for just the genetic makeup and how our DNA looks among the entire spectrum.
How did Vanderbilt get this study? Did they actually design it, or did they, apply for the ability to do the study? How did that work?
Yeah, so Dr. Zachary Warren at Vanderbilt Kennedy Center, so he applied for funding through Simons Foundation. This is a project that is run and governed by the Simons Foundation in New York. We have a long partnership with them at the Kennedy Center. We've done a lot of different things from them. They're an excellent organization. They're really passionate about this population. And it's run by Wendy Chung in in New York.
Fantastic. And I see for more information, there is a website. We've probably had it up throughout the show. There it is. sparkforautism.org/VU. And that's how someone would sign up
Absolutely,
as
yes.
well. All right. This is incredible news. And what you've shared with us with all the partnerships with Cheekwood, the zoo, on and on. A lot of hope.
Yeah, great stuff. Good news.
All right. Thank you so much for coming in. Appreciate your time and sharing such good information with us.
Thank you.
Thank
All right.
you.
And we'll be back with more after this. You know, this time of year, so many of us are so stressed out about our finances with the holidays. And my next guest, Dakota Grady, a financial planner, is here to talk about how that stress does affect our physical and mental health. Hi, how are you?
I'm fine. How about you? Thank you for inviting me.
Well, absolutely. Let's talk about, if you don't mind, because I know this was part of my notes for the show, that you had a lot of stress in this area, which probably led to you doing this for a living, right? Can you share that personal story?
Yes, I'm actually from South Carolina, and I grew up in a low-income family. And there was a point where my family had to go live with my grandmother because our lights got disconnected. So that changed my life, and just feeling the stress of living on food stamps and WIC was something that I didn't want to continue. So when I got older, I finally realized I had a gift for handling money, and I started teaching people in 2010.
So you've been doing this for 8 years, and you see the stress that it puts on people. Tell us maybe kind of what you have witnessed over the years that you've been working with people and what they're going through with their finances.
Well, I've coached people and see that it causes stress. Actually, according to research, PricewaterhouseCoopers did research saying that finances affects people's productivity at work, relationships at home, as well as the health as well.
So maybe in terms of the stress, that is something that is very, that's hard to really get a handle on or to know how much that's affecting a person, but maybe the loss of productivity and other things. Where do you start if you're living paycheck to paycheck, which that is the case for so many Americans?
Actually, you start by first having a mindset change, because people may need help, but if they don't want help, then people like me can't help them. So I think it starts in the mind first, having the mentality that I need to change my life. Start there. And then start with these 4 things. First, they need to eat food. Some people may have a credit card statement, for example, pay that bill, but not eat food. Priorities are all out of whack. So first, eat food, because you need to eat to live. Secondly, you need to pay your bills for your mortgage or your rent and utilities. Got to have lights on so you can see, read, and to live. Third, you need to have your car, pay your car payment if you have one, because you need to get back and forth to work. And lastly, have basic clothing. So you won't go to jail for indecent exposure or streaking people too, because we all need to be clothed. So I tell people that you need to have clothes on so you won't go to jail for indecent exposure. I don't know.
You're talking about basics here. We're getting back to really ground zero with basics.
Correct.
It's hard to believe that people would live that way, but when they're under that much pressure financially, you've seen that.
People need to have the basics. Instead of having things that they want, they need to have things they need first.
Let's talk about tips to deal with financial stress around the holidays, since we're right in that time period.
Yes.
In other words, I saw one of the tips was don't buy things last minute. Okay, what else do you tell your clients?
Well, first I think people need to get on a budget. Have a budget for what you're going to spend for Christmas. It's in December, right? So plan ahead, maybe in January, save up money every month until December comes. Then you can spend the money like you want to. So have a budget first and foremost. Second, the other one is to use cash. You mentioned using cash.
Yes.
That way you won't overspend your budget. And also, I think having boundaries as well, because I have a large family. I'm not going to buy for everyone. Maybe if you can do a Secret Santa, buy for 2 people, that way you can stay within your means.
And also, I was reading too, avoid the last minute shopping and pay with cash and creative gift giving. I think for a lot of people, especially older people in your family, they really appreciate something that maybe someone made for them. If it's food, if it's cookies, if it's something that you could frame, anything like that, a family picture, and you buy an inexpensive frame, that means so much more.
It does, and I have a 2-year-old daughter, so I'm sure my parents would love a gift for my granddaughter, maybe a drawing. It may not be in the colors or in the lines, but I agree that doing things that are simple, money doesn't always have to be spent in order to have a nice gift.
Absolutely. How can you get out of debt? And that is a really big question. That's the million-dollar question here, right? How do you get out of debt? What do you counsel the people you see with?
So I tell people they need to crush their debt, because debt is a thief. It steals, destroys, and people's dreams are getting crushed. So you fight back by crushing your debt. First, you list your debts from the tiniest one to the largest debt, regardless of the interest rate, and you pay as much as you can on the first one and pay the minimum on everything else. So say, for instance, if you had 3 debts, the first one you put as much money on it as possible while applying the minimum debts payment to the second 2 debts. Once you do that, it basically accumulates over time and you'll be able to come debt-free.
All right, give us a success story. Maybe tell us about somebody without naming names, protect their privacy, but can you tell us about a story where you saw someone really in the depths of despair because of their finances and that they were able to finally get out of debt?
I'll tell you my story.
Okay.
My wife and I, we were in debt and had a lot of student loan debt, a car payment, actually a big car debt. And over time, we were able to do this process I just mentioned earlier to pay off debt. And it's freeing to not live with debt. I think if people really understood that debt is a thief, and they had a mindset and a heart change that realized that it's still in their dreams of retiring, having health, because if you can't afford health care, then you more likely will have poor health. And you're stressed out, it's going to compound on that stress, and you won't be able to pay your bills. So I think if people didn't have debt, they'll be able to do more things in life, my opinion though.
All right, well, you're speaking from a place of knowledge that you've been there and you have worked through that and now helping others. Dakota, thank you so much for sharing your story. It's a good story.
Yes.
And thank you for watching Community Health Matters. You can learn more ways to improve your health on our website, mycommunityhealthmatters.org. And remember, here in Middle Tennessee, our community health matters.